Diabetes, from a new perspective, knowledge, control, and the path to well-being. Hello, community focused on health and transformation. Today we're going to dive deep into a topic that generates many doubts and, unfortunately, is still surrounded by a rather pessimistic view from some sectors. Diabetes. We often hear, including from the World Health Organization, WHO, that diabetes is a progressive and worse, incurable disease. This statement, repeated by many professionals, can cause some discouragement, especially when information arises about the possibility of reversing or significantly controlling the condition. But is this the only truth? Dr. Anonymous, a scholar dedicated to the subject, invites us to question and, above all, to seek knowledge. One of the first impacts that a diabetes diagnosis brings is financial. It's no secret that treatment can be costly, with considerable expenses on medication. Faced with this, Dr. Anonymous issues an important warning. It's crucial for patients to seek detailed information and understand whether the prescribed medications are really effective for their specific case and whether they are the best or only option available. Questioning and informing oneself is a right and a duty of those seeking the best for their own health. Dr. Anonymous reinforces a central idea. You, the patient, are the main agent in controlling your diabetes. The doctor advises, prescribes, and monitors, but the daily responsibility for the choices and management of the condition is yours. And to assume this role with confidence and effectiveness, knowledge is the most powerful tool. It's essential to understand the causes of diabetes, how it affects your body, and, most importantly, how to act to keep blood sugar under control and avoid complications. Don't be a mere spectator of your treatment. Be the protagonist. Let's talk a little about the medications that are frequently offered, including by the public health system. Metformin, for example, is widely used and considered a good and safe medication, which mainly helps to reduce insulin resistance, one of the central problems in type 2 diabetes. On the other hand, medications such as glibenclamide and glyclazide, or Glyphage, as it's sometimes known in its variations, generate more reservations on the part of Dr. Anonymous. His concern lies in the fact that these drugs stimulate the pancreas to produce even more insulin. Although this may lower blood sugar momentarily, it can lead to pancreatic exhaustion in the long term and bring other undesirable side effects without treating the root cause of the problem, which is often resistance to the action of insulin and not the lack of it. In addition to the options of the public system, pharmacies offer a vast array of other medications for diabetes. With so many options, the question naturally arises, which is the best for me? Are they really bringing benefits, or just masking the symptoms? Dr. Anonymous advises a critical and continuous evaluation, always with medical supervision, but also with the patient well-informed. To simplify, diabetes medications in general act in two main ways. Either they try to enhance the effect of the insulin that your body already produces, as in the case of metformin, which helps to unlock the action of insulin in the cells, or they force the pancreas to release more insulin into the bloodstream. Understanding this basic mechanism already helps to better understand what each medication is doing in your body. And speaking of insulin, what is its true role? Insulin is like a mail carrier that takes the glucose, sugar, that is circulating in the blood after eating and delivers it inside the cells, mainly in the muscles, so that it can be used as energy. This process is vital. However, warns Dr. Anonymous, under certain conditions, especially when there is excess circulating insulin and muscle cells are resistant to it, this same insulin may end up directing glucose to be stored in adipose tissue, that is, in fat cells. The result? Weight gain and a vicious cycle that can worsen insulin resistance. Dr. Anonymous uses an interesting metaphor to explain the balance of glucose in our body. Imagine a seesaw. On one side, we have the pancreas's ability to produce insulin. On the other, we have the ability of this insulin to store glucose inside the cells efficiently. When one of these sides is unbalanced, whether because the pancreas can't handle it, or more commonly in type 2 diabetes, because insulin can't act properly due to cellular resistance, the seesaw tilts and glucose begins to accumulate in the blood, characterizing diabetes. Here we come to a crucial point that Dr. Anonymous always emphasizes: the importance of priorities. Changing eating habits, opting for real food, and including regular physical activity in the routine are absolutely fundamental and, often, more effective than many medications for controlling diabetes, especially type 2. Unfortunately, many people only give due priority to these changes when the situation has already worsened, when the complications begin to show signs. Don't wait until you reach that point. Prevention and active control from the beginning are the best way. It's important to demystify one thing. In the vast majority of patients with type 2 diabetes, the pancreas still produces insulin, often even in sufficient or excess amounts at the beginning of the condition. The big issue, as Dr. Anonymous points out, is that this insulin cannot perform its function properly because of the excess glucose consumed and the resistance that the cells have developed to it, often associated with an inadequate lifestyle and the accumulation of visceral fat. The body is flooded with glucose, and insulin, even present, can't handle it or finds the doors of the cells stuck. Understanding these mechanisms is liberating, as it shows us that we have a much greater power of action than we imagine. Instead of relying exclusively on medication solutions that often only manage the symptoms, we can act directly on the causes, promoting a real rebalancing of our organism. And it is to help you in this journey of knowledge and transformation that this channel exists. We want to equip you with clear, science-based information, but translate it into a language that everyone can understand. We believe that with the right knowledge, you can make more assertive decisions about your health and your treatment. Did you enjoy better understanding how diabetes works and what are the real keys to its control? If this content opened your eyes and gave you new perspectives, we have an invitation that can change your relationship with your health. Subscribe to our channel right now. By activating notifications, you won't miss any new videos, any valuable tips, any detailed explanations that can make all the difference in your daily life. If this video helped you, don't forget to leave your like. Your thumbs up is an important sign for us, showing that we are on the right track and motivating us to continue producing relevant and quality content for you. Do you have questions? Do you want to share your experience or have a topic suggestion that you would like to see addressed here? Use the comments section below. Your voice is fundamental to building a strong community, where everyone helps each other and exchanges valuable information. And of course, if you know someone, a friend, a family member, a colleague, who also needs to have access to this information and can benefit from this knowledge, share this video. Let's create a chain of good together, spreading health and hope. Taking control of your health and your diabetes is a journey, but you don't have to walk it alone. With quality information, support, and the right strategies, a full and healthy life is within your reach. Count on us. A big hug, and see you in the next video.